This is Matt Walsh, and it's Wednesday, April 22nd, and this is your Minute with the Mayor. Council Bluffs currently has very limited numbers of infected people. Fortunately, we've had no new cases since last Thursday. Please note that the 3 infected Tyson workers are actually Omaha residents. Potawatomi's patient count remains at a total of 18 confirmed COVID-19 cases. 16 of those patients have recovered. 1 remains self-isolating at home, and we had 1 death. That said, yesterday the state of Iowa reported its largest single-day increase in total new cases. This serves to remind us that this pandemic is certainly not behind us yet. An update on the Council Bluffs hospital statistics: 81 regular beds are available, 32 ICU beds are available, and 40 ventilators are available. Healthcare workers currently have adequate PPE. For the most part, Council Bluffs' confirmed cases can be traced to known chains of transmission. We need to continue practicing currently prescribed methods of containing the virus. Use personal protection equipment when going out, observe social distancing, and continue disinfectant cleaning. Please recognize that bleach is poisonous. Do not disinfect your food with bleach. Just use water or soap and water. Both work well. I again stress the fact that this is a new strain of virus that involves multiple health-related factors that we currently don't fully understand. Over time, we'll continue to learn more about the COVID-19 coronavirus, how it is mutating, the duration of the immunity, and its transmission dynamics. The threat of COVID-19 on our lives and livelihoods won't fully be resolved until enough people have become immune to the disease, which will blunt its rapid transmission through our population. Immunity occurs either through a vaccine or from direct exposure and recovery. Until that time, we must have public health systems that are strong enough to detect the virus and quickly respond to new cases. As cities begin their preparation to relax distancing measures, an increase in widespread access to viral testing will become increasingly more important to help us quickly detect and control flare-ups. Our health systems must maintain the ability to manage the resurgence, including establishing designated quarantine facilities that are necessary to help localize hotspots. Iowa's governor has announced the state is partnering with Nomi Health and its subsidiary Domo to begin expanded COVID testing. This $26 million contract involves a 6-month agreement to administer free COVID tests to a total of 540,000 Iowans at a rate of 3,000 tests per day. Governor Reynolds has also kicked off the Test Iowa Challenge. She is encouraging Iowans to go to testiowa.com and complete the associated health assessment. The information you provide is confidential and is governed by HIPAA protocols. This assessment is an important step to help Iowa build the health database that it needs in order to make strategic health decisions. We will need to develop a system of effective antibody testing. Accurate and widely available antibody tests will help us to know how close we are to achieving herd immunity. Herd immunity only occurs through increased exposure in the general population to the virus. Effective herd exposure isn't achieved until at some point 70 to 80% of the population has developed COVID-19 antibodies. With previous coronaviruses, people who were exposed to the virus have exhibited durable immunity for several years after their exposure. Over the long term, scientists need to develop both therapeutic medication to treat the symptoms and ultimately a vaccine to inoculate the population. 7 vaccines are already being tested in human beings. But recognize that if a vaccine is determined to be effective, then large-scale production and distribution is not likely until 12 to 18 months after the completion of the successful trial. The American Red Cross is in desperate need of blood. Their sanitized facilities and strict health practices will ensure your safety. They ask that you call ahead and make an appointment so that they can get you in and out quickly. That's your Minute with the Mayor. Do something kind for a couple of somebodies today. Thank you.